Hi, I'm John Reynolds, President and Chief Executive Officer of CieloStar. And today I'm joined by Pierce McNally, our Chief Strategy Officer. And we're going to talk about Cielo Choice, a private exchange, and the types of solutions that hang off of it to enable consumers to be more engaged directly in the finances of their own healthcare.
John, I think it's one thing is for certain in this whole chaos of healthcare in 2013, and that is that the consumer is going to have to take more responsibility for the financial aspects of healthcare. One of the things that we have been working with at CieloStar through the Cielo Choice Private Health and Benefits Private Exchange has been this whole alphabet soup of
health savings accounts, flexible spending accounts,
FSA,
health reimbursement arrangements,
HRA, and all of that. And I think that as we take a look at it, more and more people are probably going to be offered high deductible health plans, which will then allow them to have a health savings account or an HSA associated with it. Could you tell us a little bit about what that HSA does?
Sure. Well, a health savings account is really a tax-deferred account that's set up that employees contribute to. It's typically done through a payroll deduction that happens on a bi-weekly cycle, let's say. And those dollars are set aside for use for health-related expenses.
Okay, so on a tax advantage basis, people are capable of reducing their taxable income, putting that money aside into an account that will allow them to make up the difference between what the health insurance will pay and what they will be responsible for as consumers.
That's right. I mean, I think for a lot of individuals, it's going to come as a bit of a surprise, the amount of gap between the deductible and the out-of-pocket maximum. There is a fair amount of personal financial responsibility. People have to save to cover these expenditures. It could be $5,000, $8,000. It's a significant dollar amount, and these tools are important.
I think as we go forward, one of the things that we're going to see is that it maybe is going to look a little bit more like the retirement world, where the retirement world moved much more toward individual responsibility by having people set up 401ks, which they could contribute to as well as the employer.
Well, I think that's right, and I would think that another important component to the health savings account that's different from a 401k is that you need to be able to access those funds easily when you need them. So unlike a 401k where you're setting aside monies for use 10, 15, 20 years down the road, a health savings account is a transactional account, and it's anticipated that people are going to be transacting against that account potentially every month or as needed. You know, you go to the doctor, you go to the dentist, you go.
So it's flexible, it's easy, you can carry it in your pocket, and you've got the ability to take care of that without going through a lot of paperwork and bill chasing and all the rest of that.
That's right.
I think that the Cielo Choice Health and Benefits Private Exchange would be a great place for people to go to address these issues in terms of getting coverage as well as the benefits that they would receive from something like an HSA, because that will show how it all comes together in a very simple, easy, and flexible manner. And with that was a great healthy exchange. And we'll talk about MediCheck on our next one, and we'll see you then.